Morning, everybody. Sorry, I did intend to be here before morning tea, but at least when people say, what's the Labor government ever done for you, you can say we've got an early morning tea out of us. I acknowledge that we're meeting on the land of the Gadigal people. I pay my respects to elders, past, present and emerging. And I echo the voice of so many other people to support the referendum for recognition and voice in our Australian Constitution later this year. I think it's long overdue that we acknowledge our First Nations people who've walked this land for 60,000 years in the nation's contemporary birth certificate. At the end of last year, there were approximately 60,000 participants on the scheme whose primary disability was that of a psychosocial condition. Of course, there'll be many more who will have, as part of their other disability, a mental health overlay as well. Within the scheme, and I'll come back to the concept of within the scheme, but within the scheme, there has actually been a significant increase in support for people with disabilities from severe and persistent mental illness. The best numbers I can extract for this conference are that if you look over the previous 12 months, something like $3.96 billion is expended in terms of with the category of psychosocial conditions within the scheme. So within the scheme, for all of its imperfections, and there are many, it is still, I think, at least headed in the right direction. And it is making a life-changing difference for people who are on the scheme. But I think the big challenge is, if you were to distill it, what do we do outside the scheme to help people whose disability is not so significant that would put them into the NDIS, but who still require support? There are services which we do at the moment, family mental health support services, there's programs for early childhood education, there's support for individuals and families affected by past institutional policies and practices. There is support for children and young people who are showing early signs or at risk of developing mental illness. There is a national housing and homelessness plan, which is self-evidently critical. There's a national agreement on closing the gap, which assists with First Nations peoples. So there are measures and tools, and the current government, the new government, is focused on the area. We recognise that it's been an area which hasn't received the attention that it deserves. NDIS is a significant investment for people with psychosocial impairment in this country, but the question which really keeps me thinking about is, what about outside the scheme? My colleague Amanda Rishworth's overseeing the Australian Disability Strategy. There's the very unlovely term Tier 2 supports. Tier 2 means for people who are not in the scheme but still require some support with their disability. That's where my head's at. That's where I think we've got to see what's innovative that we can do outside the scheme to assist people in terms of getting treatment. I guess there's a political question here too, though. Budgets are tough. Our predecessors spent $1 trillion. I'm not sure what they got to show for it, except some upward pressure on inflation. But it does mean that budgets are tough. That's just the reality that we live in. You will understand, with cost of living challenges, that every taxpayer dollar expended has got to be something which the community can see and support. Now, I think community mental health is one of the frontiers for resolving the current political impasse. I think it is a priority, but it's something we're all going to have to work on together. But what I can promise you from my world of the NDIS, we want to make the experience within the scheme as meaningful as possible, as empowering as possible. For the individual, I'm signed up to choice and control as being an approach. Giving people control over their own lives, empowering them, I think, is crucial in any scenario that we can think of. But I also get there's a challenge beyond the scheme, and the more that we can shine a torch on that and work with you on that, then I think we can improve the circumstances for all Australians. Lovely to have spoken.
An initial analysis of the many submissions we have received which refer to mental health has come back with the following insights. 49% of submissions said dealing with the NDIS has had negative mental health impacts. 29% said those negative mental health impacts included stress, frustration, burnout, depression, anxiety, and/or the escalation of a pre-existing condition. 25% said the NDIS's processes and requirements could be psychologically or emotionally damaging. 12% said the negative impacts of dealing with the NDIS affected their whole family. The NDIS is a great system when it works. The challenge we face is to make it work for everyone every day. In order to do that, we need better data, evidence, and research. The good news is that building blocks are being developed to complement the NDIS and make Australia a world leader in disability research, analysis, and policy. For the past several years, the Commonwealth, states and territories have been working together to establish a national disability data asset. When it's finished, the data asset will be an extraordinary platform for research and researchers like Lisa, as it will bring together NDIS, social security, tax, employment, medical, health, education, justice and housing data from across the Commonwealth, state and territory governments.
Last month, our government made good on those plans, announcing an investment of $8.5 million, $7.5 million towards 2 independent lived experience peak bodies, one representing consumers and clients, the other representing carers, family and kin, understanding the related but distinct priorities of both those groups. Lived Experience Australia will receive just under $1 million for its leadership in lived experience research and capacity building for people with mental ill health and carers. And $100,000 will establish a stakeholder forum to improve transparency, accountability and partnerships with the sector directly to government. As you know, family and carers are key to a person's recovery. It's something we know, which most of us have experienced. That's why our government is strengthening Medicare and implementing important changes to help family and carers participate in a person's better access treatment schedule. This year we'll also see an increasing focus on supporting multidisciplinary wraparound care through mental health case conferencing. We're working closely with the states and territories and communities around the country to boost support services, reduce wait times and improve the mental health and wellbeing of all Australians, understanding that this is a big and growing problem that we're all grappling with. We share responsibility for psychosocial supports, and in using that term, I understand people like my friend Cathy O'Toole contest that language, but using the accepted language, we do share responsibility for psychosocial supports, and at the Commonwealth level, as you're aware, these refer to non-clinical recovery-orientated supports, helping people with severe mental ill health to live independently, safely, and thriving lives in our communities. This includes services delivered through the NDIS and through Commonwealth psychosocial support programs. But we know there's a gap, and we know in places that it's growing, between the services and the needs of the community. And I want to assure you that work is underway to better understand that gap and how to address it. And I also understand there is a growing urgency. It's something that we need to do swiftly and also safely and comprehensively.